We have another national health emergency. The Red Cross declaring its first ever national blood crisis. First ever. The shortage means that doctors are actually being forced to make some tough decisions about who should get blood and who has to wait until there's more. Ileana Diaz is covering the story for us. Ileana, I know that it has been kind of a routine every year to give blood for some folks, but over the past couple of years, it's been a little more difficult.
Adrienne, it has. It's been a little bit more difficult, and we've seen those numbers go down more and more. And the Red Cross is now calling this a crisis because hospitals don't have enough supply and lives are at risk. Doctors are now having to turn patients away, and they're postponing surgeries.
The nation's blood supply is dangerously low. Some blood centers have reported having less than a one-day supply for some blood types, which is why the Red Cross has called this shortage a national crisis for the first time in its history.
Like so many people, COVID is impacting our operations in significant ways. And understandably, we know that people are taking care of themselves and others. But if you're healthy and well, we do need you to come out to blood drives.
Since the start of the pandemic, regular donors have been giving less blood. And the number of staff and employees at the Red Cross has also gone down as people have become sick or exposed to COVID-19. And blood drives across the country have been canceled.
We rely on education institutions, colleges, high schools, corporations, and again, more people are working from home or just not comfortable having a big gathering at their location. And so while we do everything possible to keep people safe at our blood drives, understandably, we've seen a shift.
Last year, Red Cross officials say they saw a 34% decline in new donors. And in recent weeks, the blood donations have dropped 10%. Leaving thousands of people who rely on blood for transfusions, chronic illnesses, or emergency surgeries with very limited supply. Now, doctors are being forced to make tough decisions.
We are putting our hospitals in a difficult position, and doctors are having to make choices in terms of the sequence of care or who gets blood first. And that's never a position we want anyone to be in, right? Neither a doctor or a patient. So we're working very hard to obviously get the word out, to increase blood donation.
The Red Cross is asking anyone that is healthy right now to give blood immediately. You can either go to their website, that's redcross.org/give. You can download the Red Cross app, or you can call 1-800-RED-CROSS and make an appointment to donate that blood. And Adrienne, there is a positive perk going on this month. If you donate right now before the end of the month, you can also be entered to win a ticket to the Super Bowl. And that's because the NFL and the Red Cross are teaming up, hoping that hopefully more people give blood this month.
You know what? I think I'm going to sign myself up. I think there are a number of people here at NewsNation who are saying, you know what, we should go give blood together. I think it would be a great way for people to show kindness to a stranger. Yeah. Ileana, thank you very much. Let's all do this together. We're in this together. We might as well try to solve it together. Thank you so much for watching. Make sure to click on the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.